The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
You can now book and pay online for your certified lateral flow test at www.hsa.ky/appointment. It's fast, easy, and convenient. Certified LFTs are $25 per test per person. HSA's testing center is located at 131 Center, McClendon Drive, behind Foster's Airport. Walk-ins for certified LFTs are also available. Need a PCR test for travel? These are now only $75. Visit hsa.ky/appointment for more information.
Once again, folks, welcome back to another edition of HSA Today. I'm your host, Chuck Taylor, and this week we're going to be talking about speech and occupational therapy, all of the wonderful things that the HSA is doing. With me, I have Miss Faith Gaeley. She is the team leader for speech and occupational therapy over the HSA. We're going to be talking with her in this episode about all the wonderful things that they're doing over there, and also kind of get an insight into all the things that occupational therapy can relate to it and how it can help the people right here in the Cayman Islands. Good afternoon, good morning, good evening. How are you doing?
I'm doing well, thank you, and thank you so much for accommodating us. We're really excited to be on it. I'm excited to be on to share, especially because the month of May is actually Better Hearing and Speech Month. So it's just a nice opportunity to highlight all of the wonderful services that we offer at HSA.
Excellent, excellent. So the month of May is actually Better Hearing and Speech Month, and this is across the island, or this is across the world. How does that relate to us?
So it's primarily celebrated in North America, but it is recognized across the world. And it's just an opportunity to kind of highlight all the wonderful things that speech therapy does and the way it impacts people's quality of life across a lifespan. The theme this year is connecting people, and so it's just a great opportunity to share how speech therapy just helps people connect with the world around them.
And this is something that people don't realize, that speech therapy can be as young as a child and as old as a mature adult.
Yes, absolutely. It is across the lifespan. The youngest client I've worked with has just been a few hours old. And the oldest clients I've worked with have been, centenarians, so well into their hundreds. And so it is something that definitely impacts across the entire lifespan. Because speech therapy is such a diverse field, and we touch across so many areas of not just speech in terms of how we articulate. I think a lot of times people say, like a lisp or a stutter. Mm-hmm. Absolutely. But we also deal with anything related to communication, including cognitive impairments that can impair your communication. And we also do a lot of work with feeding and swallowing. Okay. And particularly in beginning and end of life, that is usually where our services are most required.
And I would not have thought of it in that broad of a term. I mean, we have an understanding that, speech is, lifelong, but then what you're talking about is actually the movement of throat, and I mean, I've lost my voice and I've been hoarse, and I'm thinking, I need, better understanding of that. But you said from a few hours born to centenarians, that's a wide range.
Huge range. So yeah, it's And it's so rewarding. And I think what's nice about HSA is because we're in that medical setting, we are able to have such a holistic view of every patient. So we're not only looking at that one small area of impairment, but we're looking at the whole entire picture. How is it impacting your family, your community? What other medical professionals need to be involved? Are there any other caregivers or other parties that need to be involved in your care? So we really do a good wraparound look at everything that you need in order to have the most impact on your quality of life. And I think that's one of the beauties about working for a health service. And you see that in terms of how dynamic and the wraparound services that we offer as a clinic.
And just in listening to you, when you talk, like on average, I mean, most people think, speech impediment, but you do actually working, say, if I was in a car accident and I lost some cognitive speech, and you do therapy for those types of aspects also?
Absolutely. So we do, in infancy, a lot of times the focus is on feeding as well as monitoring. So if this is a child who has a genetic disorder or may have been premature, then we definitely want to keep tabs on that child and make sure that they're developing appropriately. So then our role would be in preventative care. As children get older, what we're looking at are, disorders of speech. So are you pronouncing all your sounds appropriately? Is your speech fluent, or is there stuttering concern? Are you developing language typically? And then as there's any residual feeding issues as well. As we go into adulthood, for most adults, typically it's something that is an acquired disorder. So a lot of times, if you mentioned you lost your voice, so maybe someone who's like a radio announcer like yourself, or teachers or singers, maybe there's a lot of voice misuse or overuse, and so therefore that's where a speech therapist comes in. Or I was in a car accident, I had a brain injury, or I've had cancer, and that's impacted my communication, or I've had a stroke. So usually there's something acquired.
And I think that's one of the things that people, communication is on so many different levels and such a vast understanding. I mean, if someone can't communicate, it's frustrating. They get irritated. And also on the receiving end, also people don't understand how to receive a person who has some sort of diagnosis for miscommunication, and just in work with the therapy, I would think that would be a huge area just for outside training, not just for the person, but also for the caregivers, the family members, and things of that nature.
Absolutely. And again, I think that's something that helps HSA to stand out, because again, we look at the whole picture and trying to advocate for the patient as a whole. One of the things that are so frustrating for a lot of our clients is that, they'll share like, I am struggling communicating, but there's nothing wrong with my brain. There's nothing wrong with how I understand and perceive the world around me. And I think a lot of times people think when there's something wrong with how someone communicates, it means that there's something wrong with them intellectually, and that's not always the case. And so this is where we really help our patients to advocate for themselves, to educate their employers, their families, the people around them, to say, this is how you can be inclusive. This is how you can support this patient during this time. And then we try to give the patient strategies that help them now, as well as work on therapy modalities and techniques that are going to help them improve in the future.
And that's one of the things I think that separates when you're working hands-on approach rather than you see a person once every month or once every 2 weeks and on these types of things. Now we kind of understand, well, certain of the bigger forms of communication, dyslexia, we hear those terms often. But, when I was growing up, that was almost like a dirty word, a child that had a learning, and I don't want to say disability, but a harder time understanding was also, kind of shunned. Oh, they're not smart. We hear that a lot in society, but this is kind of changing that thought.
Absolutely, absolutely. And I think the more people have a better understanding of what disabilities are and, how we can live more inclusive lives, I think the more people will realize that, it's really nothing to shun someone over. It just means that we just need to tweak how we interact with that person so that they can have access to the world around them.
It makes perfect sense. So, I mean, I'm sure there's a lot of planning and things. Give me an idea of what, you guys have planned for the month. The month is rolling through, so I'm sure you guys have done some stuff. So just give me an idea of what you've been up to.
So we've been actually really busy in clinic, and we've had some unexpected sickness in the clinic. So some of our staff have been ill, which has kind of impacted our ability to do the things that we would normally do. So we've just been focusing primarily on social media and just doing these types of media blitzes just to kind of remind people that we're here and these are the services that we offer. And we're continuing to expand. Every year we've been growing in numbers as well as in the services that we offer. And so we're really proud of how much growth that we've made, especially over the past 2 to 3 years. And we're hoping to continue on that path so that we can better meet the needs of the community.
Perfect. We're going to take a quick break right here. We're going to come back in just a few moments. You're listening to HSA Today with Chuck Taylor, and I am talking to none other than Miss Faith. She's the team leader for speech and occupational therapy over at HSA. And just a reminder that all of May is Better Hearing and Speech Month. We'll be back in just a few moments. Thank you for listening. This is Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
You can now book and pay online for your certified lateral flow test at www.hsa.ky/appointment. It's fast, easy, and convenient. Certified LFTs are $25 per test per person. HSA's testing center is located at 131 Center, McClendon Drive, behind Foster's Airport. Walk-ins for certified LFTs are also available. Need a PCR test for travel? These are now only $75. Visit hsa.ky/appointment for more information.
Keeping you up to date with information you can use. Bobo 89.1 FM.
And we're back. It's HSA Today with yours truly, Chuck Taylor, and I am talking with Faith. She's the team leader for speech and occupational therapy over at HSA. And we're kind of getting into the trenches and talking about Better Hearing and Speech Month, which is happening all of the month of May. So how do you recognize, because I guess it tends to be on the outside before they can come in on the inside. If someone sees a child or maybe an older adult and it's getting a little bit harder to communicate, what are some of the signs that we can look for to say, okay, you know what, I should go talk to somebody ASAP?
So for young children, you're going to just notice that they're not really picking up words the way that you would expect them to for their age. And you'll notice that the child is using more behaviors to communicate. So more tantrums, not really we tell people red flags would be not having those first words by a year, not having 15 to 25 words by 18 months. So those are some red flags. If the child is not really responding to their name, if they're not starting to put, two words together and they're close to 2 years old, those are all red flags of children who might have some delayed speech and language issues. Children who are also like really unintelligible. So maybe it seems like they're saying a lot, but it's just really hard to understand what they're saying. So those are some red flags. You definitely would like to speak to your child's pediatrician or to your GP and see if you can get a referral. Our approach is always we'd rather assess the child and tell you that there's nothing to be concerned about than have the wait and see approach and miss out on an opportunity to provide good early intervention. So we're always happy we'd rather see and reassure than not see and miss out.
Mm-hmm. I guess being an early intervention,
prevention is always better than cure. And especially when the child is really young, using really fun, family-centered, play-based approach, child-led approach, we incorporate a lot of parent training and empowerment into our sessions because we recognize that you're the primary person who's around your child. And so we think it's more important for us to teach you how to be your child's primary communication partner than it is for you to be sitting outside of the room and us working with your child one-on-one a couple times a week, And so we really try to use a holistic, family-centered approach that really empowers families. And, it often leads to quicker remediation where the child tends to, if it's just a regular speech and language delay, maybe the child is just a late talker, very often in a few months, that child is ready to be discharged. And then if it's something else, if there's concerns about autism or other types of cognitive issues or neurological issues, that early intervention really helps to drive that process to see if we need to do some more differential diagnosis. And again, having that early diagnosis just helps us to make sure that the child is getting plugged into other services that they may need, other supportive therapies, other parent and family coaching things, the early intervention program, maybe the child needs a developmental teacher. So there's so many resources on island, and the earlier the better. When it comes to children with speech and language delay is definitely the rule of thumb.
Early on, you would kind of see these red flags that you're saying, but say an adult has slipped through the system, they're working, they're being productive citizens, but all of a sudden now that roadblock that was a childlike thing is now coming back into play.
Right.
This I've read this happen several times in surprisingly in the radio industry. A couple of DJs, they had some sort of stutter streets when they were kids, and over the course of time it came back. How do you approach an adult? So I know it's separate from a child, but how do you approach an adult intervention?
So when it's an adult, what you want to do is talk to your doctor as soon as you find that it's impacting your quality of life. So if it's starting to impact your employment, if it's starting to impact your social interaction, your ability to do your activities of daily living, come in and ask for, talk to your doctor, ask for a referral, come in, sit down with us, have an assessment with us so we can look at what exactly the concerns are. For things like stuttering is a lifelong disorder. And so there are times due to health reasons or stress that it can sometimes ebb and flow. But what we can do is work with you on different strategies that maybe you haven't tried before to see if it can help improve the fluency of your speech and reduce the impact that it has on your communication. If you're noticing that you're having chronic hoarseness, again, you want to talk to your ENT or you talk to your GP and come in for a round of speech therapy. We can give you some vocal hygiene and some exercises to help improve your quality of voice. Or for older persons, if they're noticing that maybe they're just having some issues with memory, you're noticing it's harder for you to remember things, you're noticing you're avoiding talking on the phone, or you're avoiding larger crowds of people. It's little subtle personality changes as well. Those are often early signs of dementia. Maybe I'm struggling with doing the mental math to sort out the tip at the restaurant, or I am having to rely on my spouse or my children to fill in the blank for me more. And so with dementia, early intervention for dementia actually can help to preserve cognitive function and slow down the level of decline. And so I often encourage people, like a lot of times people try to hide when they're having these cognitive issues because they don't want their family to be concerned. And especially in Cayman, where we have a huge genetic predisposition to dementia. It runs very prevalently in certain families in Cayman, right? And so we have some wonderful dementia resources here. There's the Alzheimer's and Dementia Association of Cayman Islands, who do wonderful trainings for caregivers. But one of the biggest barriers that we find is that families are not, no one's seeking diagnosis until they're in the mid to late stages. And at that point, it's really just about training caregivers and modifying the home environment to help that person be comfortable and prepare for end of life. But I have clients who've been picked up on the earlier stages of dementia, and just through weekly interventions, we're able to do cognitive stimulation things, memory strategies, and just really, really help preserve and delay that decline. And, that can help that person to lead a good quality of life, extended by a year or two, maybe even 3 or 4 years in some cases. And so when you think about dementia being a disease where you almost lose your loved one twice because you lose them cognitively and then you lose them physically, and you get an extra couple of years with that loved one. I mean, why not seek that early diagnosis and do what you can to preserve function, not just for them, but also for your ability to interact with them and have, that extra time with that loved one, and so I'm actually a certified dementia practitioner. So dementia is one of those things that's near and dear to my heart, and it's just really nice to be able to work with families so that, we can pick up on these subtle changes to say, hey, I'm noticing that, with the math stuff, we're declining from 3 digits to 2 digits, and it's just a lot of these fine differences that the average person wouldn't necessarily be able to pick up on. But in cognitive therapy, we can pick up on those things. And so it definitely is helpful to get that early diagnosis. And so don't be afraid to get the diagnosis, because there's medication routes. There's a lot of things we can do to decline, to slow down and delay the decline in function.
I think that's one thing as a whole for the Caribbean, that most Caribbean families are very reluctant to talk and have that conversation, even with a professional. It's kind of like the family secret. Oh, you know what? But the reality is that there is solutions to it, a better way of doing it. Quality of life is very important nowadays. And this can improve the quality, not just for the person, but the family as a whole.
Yes. And it's also, when you think about it, also from a safety standpoint, right? Because if the community is aware, and the people in your village is aware. So, I've had patients before who I know that they had some cognitive issues, and I'm driving to work and I've seen them on the side of the road hitching, and I'll pick them up and I'll call, I'll be like, yeah, come on, you're going to town, no problem. And I'll call the family member, be like, hey, is somebody missing? Oh my gosh, yes.
The back door was open and they came out and
came out, they might have rummaged through somebody's handbag to get some bus fare, because a lot of those things, those routines are embedded, and so they're not always self-aware that I'm not safe to go out on the road on my own. And so the more people who know, the more people you have in your circle looking out to say, hey, this loved one came out, but I was able to drop them back home, or I have them with me in my office. I saw them walking around in the middle of town. I have them with me now at the hospital. We have lunch. We're having a good old time. they think they're visiting me, you know? And so it's just a way that it helps to keep that loved one safe and secure, and that it's someone familiar, so they can go with that familiar person, and then the family can feel like, oh, there's more people kind of keeping eyes out for my loved one, because those are big safety concerns that are real issues. And I think the more people that we know in our village, we're still lucky in Cayman that it's still fairly safe and still a very friendly place, and you know, we want to make sure that you have that community support for your loved one that keeps them safe.
And that's the key right there, keeping them safe, because, and I say this all the time, you know, in the U.S. and other bigger places, you get lost very quick. You know, it's very hard to keep that, but we have been blessed that, you know, we know most of the people on our road or you know, in our neighborhood or in our vicinity, and people are always on, oh, that's cousin so-and-so, aunt so-and-so, you know, we went to church, you know, you know, the different avenues and different things, but helps keep that person safe as they get older in age.
Yeah.
And still gives them a certain amount of mobility and freedom, but it's still confined.
Exactly. You know, and so I think, you know, having communication disorders, having feeding issues, having speech issues, you know, none of these are anything for anyone to be ashamed of. You know, I love in the, you know, as the world, we're kind of transitioning worldwide into a more inclusion-based model for disability. And I think that's one of the wonderful things about HSA is that, you know, there's a medical model for disability and there's a social model for disability. But even though we're a hospital, our approach to disability is a very inclusion supportive approach, because it's not about profit. We don't make profit. we are here to serve the community. So it's
a very different mandate from the hospital systems of the world that are all about that.
Exactly. And it's not, you know, it's different. It's because we're not about making profit. We're really about making your life as functional as possible, you know. And so one of the beauties of that social approach to disability and that inclusion approach is the view that everybody who does not have a disability is what is referred to as a temporarily able-bodied person. You don't have a disability yet, because the fact of the matter is, at any point in our lives, anything can happen, and we can have a disability, whether it be temporary or permanent, right? And so I think if we live our life with that view, having a disability is nothing to be ashamed of. It just means that you are accessing the world in a different way. And how do we modify your environment, and how do we support you to be able to still maximize your ability to enjoy meals, to maximize your ability to communicate, and to maximize the ability of other people to communicate with you, you know? And that is our approach to providing services for the Cayman community.
That is such a beautiful thing to hear. Once again, folks, you are tuned in to HSA Today. I'm your host, Chuck Taylor. We are live and direct on Bobo 89.1 FM. I have a team leader of speech and occupational therapy at the HSA talking with me, Ms. Faith. We'll be right back. Keep it locked in.
Keeping you up to date with information you can use. Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
You can now book and pay online for your certified lateral flow test at www.hsa.ky/appointment. It's fast, easy, and convenient. Certified LFTs are $25 per test per person. HSA's testing center is located at 131 Center, McClendon Drive, behind Foster's Airport. Walk-ins for certified LFTs are also available. Need a PCR test for travel? These are now only $75. Visit hsa.ky/appointment for more information.
Keeping you up to date with information you can use. Bobo 89.1 FM.
You're listening to HSA Today with Chuck Taylor and also Miss Faith, team leader for speech and occupational therapy over at HSA. We've been tossing ideas and talking about how to make your life better when it comes to hearing and speech, because this month is exactly that, Better Hearing and Speech Month. So Ms. Faith, tell us a little bit about some of the training and some of the things that all of your team has gone through and just some of the programs that you operate.
We offer, like I mentioned earlier, we do offer quite a wraparound service. I think one of the things that makes us stand out is how culturally responsive and culturally competent we are. We provide services in inpatient, acute inpatient, outpatient. We also offer home health for our bedbound and elderly patients in the community, as well as our medically fragile people in the community. And we also offer telehealth as well. That is something that we started during COVID, and we continue to offer it as a service delivery option. So we do provide a wide range of settings in which we can provide your services in. Currently, we have 3 speech and language therapists on our team, and we're expanding hopefully by 2 or 3 more before the end of this calendar year. So we're really excited about the growth that we're making. So currently on our team, we have 3 speech and language therapists, myself included. So we have Ms. Emily Runnell, who is a certified bilingual pediatric speech therapist. And so she is a bilingual therapist that can provide interventions in both Spanish and English. She also is certified in oral myofunctional therapy, which is a special type of oral motor therapy that is really helpful for people who have issues with their dentition, helpful for people with tongue thrust, cleft palate, any issues like residual issues with tonsils and adenoids that can sometimes really impact the way that the mouth and the tongue and the teeth are formed. And so she has a specialty area in that as well.
That alone is a lot.
It's a lot. We do a lot. We also have this Raven Ramon, who is a Caymayan speech therapist, which I'm very, very proud of. I'm very proud of her. She is actually our pediatric feeding specialist. So she has advanced SOS training, which is this sensory oral sequential approach. She also has done advanced training, so she does a lot of our NICU babies now, our children who are tube fed. So sometimes when children have genetic issues or premature or have, unforeseen complications, sometimes they require to be tube fed. And so she works a lot with those families, supporting their transition from tube feeding to oral feeding, and does a lot of work with families with children who have significant feeding issues. So children, for example, with autism spectrum disorder or who have other types of severe feeding issues. She is our go-to person for that, and she works with children and families with their feeding concerns. She also, both Raven and Emily are also certified in the natural language acquisition approach, which is a special approach for children with autism and children who are Gestalt language learners. And Gestalt language just refers to a different way of learning language. So a lot of times children with autism or children who learn language in this way don't learn language in terms of single words and then adding on to that. They learn language as whole entire units. And so these are the children who might be echolalic. So they might be able to say the whole cartoon, but if you ask them their name, they're not able to respond.
Okay.
And so they're certified in an approach that helps those children kind of break down those gestalts into more functional, meaningful language. And so both Raven and Emily also are our early interventionists and pediatric speech therapists as well. So they are both amazing clinicians and bring so much wonderful goodness to our team. And we're looking forward to our new hires that we'll have later on this year to only add to that. And then we have myself, and I am a generalist speech therapist, which is a bit of a unicorn in the world because now everybody usually has very, very specific areas of specialty. But over the years, I have really done a lot more in terms of the adult neuro side of things. And so I am an adult dysphagia specialist. So I specialize in adults who have acquired swallowing disorders. So this is a result of a stroke or dementia, cancer, those sort of things. I have certifications in the McNeil Dysphagia Therapy Protocol. I think I'm one of the few people in the entire region who have this certification. I also am Vital Stim certified, which is a neural electrical stimulation approach to supporting swallowing and oral facial weaknesses. I'm also a certified dementia practitioner, and I also have advanced training in voice therapy, cognitive communication therapy approaches for stroke, for dysarthria, for a variety of Parkinson's disease, ALS, so a variety of different disorders. I've done some advanced trainings in how to support patients with those diagnoses. And I've also done a myriad of stuff with children.
I'm just amazed at the qualifications. I will be honest with you. I'm big on qualifications, but what you just told me, that is, you're talking NYU. You're talking. We
all have masters. We're all master's level trained speech therapists as well. So we all have our master's degree.
I feel confident with saying that we have probably the best equipped in the region by far. Just by hearing by hearing all of the specialty areas that your team has acquired over the years. I had no idea that this was because I don't have a child or a person that's in need of it. But as you said, that can happen at any moment in time. It can change. Mm-hmm. It's good to know that you guys are there and able and willing to take on the challenge.
I think people sleep on HSA. I think they assume because it's a public agency and they just assume that we're not up to par. But actually, we are an amazing facility, and our team is just out of this world. Like, we're very, very fortunate. We have one of the most robust speech therapy programs, hospital-based programs in the region. So we do work collaboratively with, other hospitals in the region. They reach out to us, ask us for advice, for support. I'm one of the founders of the Caribbean Speech Hearing Association, so I do a lot of regional mentorship as just for my own volunteerism efforts. And we're really, really blessed by the amount of therapists we have, as well as the competency and the qualifications and the quality of the therapists that we have, because our therapists aren't just qualified, but we're compassionate, and we really, really care about the people that we work with.
And I think that in itself is the beauty that makes the HSA so humanistic. And I try to use that term because people don't understand, hospitals in the world are very clinical. They're very cold. They're very about the dollar, or they're very about the procedure. They're not about the person. And that is one thing I can say that HSA over the years, I've seen it, they go far and beyond the call when it comes to being human. And I think that is the beauty of this island.
Yes. Yeah, we really live by our core values. And as a therapy team, not just speech, but our OT and our PTs, we really do our best to live out those HSA core values and what we do every day, and the quality of care that we provide to our patients every day. We go above and beyond for our patients consistently. And it's not about who you are, because every single patient who walks through the door is a VIP as far as we're concerned. So we will bend over backwards for anybody.
Perfect. And we still got a few more moments here. Don't forget, folks, how can they get in contact with you?
Yes. So you can reach us at 244-7675 or 244-2730. And you can email our registration person. His name is Randy Young, very pleasant young Kimanian guy who is always happy to support. So you can reach out to him. He assists with all of our speech and occupational therapy registration needs. So Randy, Randy, .young, YOUNG, at HSA.KY, or you can email me at Faith, FAITH, .Gaeley, GEALEY, at HSA.KY.
Perfect. And folks, as I said, we were having the discussion earlier. If you're just tuning in, this is something that's not to be hid and not to be shunned. This is something that can improve the quality of life for a child, an adult, an older person. It doesn't matter, because it can happen at any point in time. And as Miss Faith said, it can be little things, that turn into monster of things. All of a sudden, you wake up one morning, and you can't, you don't have a voice, you can't talk, and there are signs and things that build up to that, and those are the things that her team looks for and help, alleviate and also, help the family, because it's all about the quality of life that we're talking about.
Absolutely. And that's our goal, is to make sure that everyone has a good quality of life. Our goal is not for you to be perfect on the test. The tests are helpful, but it's not about that. We're not following this regimented thing to say, oh, it's so restricted. No, I sit with my patients, my adult patients, and I'm sitting down and I'm like, okay, do you have issues on the phone? Let's practice. Let's do some phone calls.
Mm-hmm.
Are you having issues in the restaurant, in the bank? So people will see me out, like at A.L. Thompson's and the DMV and all of these places with my patients. And, they're like, how is that speech therapy? You need to be able to communicate in the community that you live in.
True. Very true.
And so it's like, if we can do it in the clinic and you're doing it fine in the clinic, well, let's go see how you are out in the real world. And then I'll feel okay,
And that's the beauty of it. You have a vested interest in this person. This person is part of you, because they're part of your community also.
Yeah. And we're so proud of that. We have some great mentorship programs. So in the summer, we're hoping to have some more students with us. We typically have students every year. And, when I first came home, there weren't very many of us came out as speech therapists, and when I came home, there wasn't anything called speech therapy at HSA,
Right.
And so it was literally building up a service from scratch. And, over the past, I've been a therapist for 15 years, 14 years at HSA, and, just seeing how it's grown, seeing, we have Raven, who's also a K-Mayan speech therapist. We're hoping to have another returning K-Mayan student join us later this year after she graduates this year. We have a couple students that are in school studying occupational therapy and speech therapy that we keep tabs on them throughout the school year. So we're really trying to build an organic service that is really helping our community, because you know what? It hits different when it's your grandmother's friend.
Mm-hmm.
It hits different when it's your schoolmate's child. It hits different when it's your classmate who was in a car accident. It hits different. This is this is someone in your community who you know, and you know their family, and you know how important, eating and drinking and communicating and talking is to this person.
Yeah.
And
We,
so
we, we take those things for granted. We just assume everybody, they can do it. They can do it. But the reality is, when they can't and you see it firsthand, then it impacts you so differently.
Yeah, it does. And so I think, the fact that we've been able to grow the service with other young Himalayan professionals, I think is just a wonderful thing, because again, there's so many cultural aspects to things that, you can sit and you can talk to that family and say, listen, I know you guys might be worried about X, Y, and Z. And they don't even have to say it because you know where they're coming from,
Mm-hmm.
And so it's just being able to connect in that way, in such a culturally competent and culturally responsive way, I think is just so, so important. So it's something that we're really, really proud of as well. So it's just, we've been growing. It's been slow and steady and organic, but it's been good growth, strong growth.
Perfect.
And we're hoping to continue on that path.
And I think that's the thing that we love to hear, that it's continued on, because the support staff that is around you help that growth. They help push the idea of, hey, this is a clinic, this is a core that is going to be the backbone in here in the Cayman Islands, because as young kids come into the world, our older folks get older, and one day we will be older too, God willing. And
absolutely,
this is a service that we may have access to or may need access to.
Exactly. And that's something I tell the team all the time. I'm like, my goal is that I want HSA to be a facility that I am happy to go to, that when I'm old, that I know that whoever is behind me is going to do a great job with me, the same way that I'm going to do a great job with the current generations that I'm working with now. And I think if you have that approach of legacy and making sure that you're leaving HSA a better place, when you retire, and that you've done what you need to do to build a service that is growing and thriving and something you can be proud to access as a patient. I access services at HSA, and I've always received outstanding care, compared to, I think especially those of us who've lived in other countries and other jurisdictions, but we have something to compare it to,
right.
So I think sometimes we'll complain
you're
here.
just not a number. You're just not a patient 5693. You're up next. They say your name once and they give you a ID swipe, and that's it. You're in the system, and that's the end of it.
Yeah, and even I think people get surprised by, they think like our wait times are so long, and it's like, I remember working in the U.S. and I remember at an outpatient clinic I was working at, them saying like, oh yeah, this family, we're interviewing the family, and the family was like, yeah, I waited like a year for this appointment. And I'm thinking like, what?
What?
This is
A
in the
year?
States.
Yeah, but and that's the reality up there.
And that's the reality. And so here, when families are like, oh, I have to wait 2 weeks, it's like, that's not a bad thing, because the family will wait a year to be assessed, and then we'll wait another, 6 to 9 months to get treated,
and worse if they got to get placement, then you're talking a whole realm. I've had a friend of mine who had, now that you bring that up, they had some home therapy, and literally they were like, I got to leave work because if I miss this appointment, I can't get another one for 8 months. And I'm like, what? Huh?
Yeah.
But that was it, and they were thankful for that. They were like, oh, they finally they got me, they slipped me in, and I'm thinking, slipped you in?
Yeah.
But then I had Cayman where I could just walk in And within a few days or a few hours or a week or so, I had an answer. And, I guess you could call it jilted by it, because I was so used to, HSA,
Yes.
we could just walk in there anytime. No, not in the world. We are privileged here.
Super privileged. I mean, we have an amazing healthcare system, amazing qualified staff. And so I think we're just so blessed, and I think HSA has grown a lot since I've been at HSA, not just in my field, but like all around. And, I'm just so excited for all the changes and all the growth that's happening at HSA, because it is truly going to be a world-class health service system when we're done.
Mm-hmm.
I don't think we'll ever be done, but, it is. I mean, the growth, it's, when I go away to conferences and I tell people about HSA, I say it with pride, because people are like, "What? That's so amazing!" Their mind is blown. And these are people from major cities, major hospitals, major networks, who are always just so impressed by the breadth and depth of services offered at HSA. So, I'm so proud to be part of the HSA team, and I'm just thankful for the opportunity to serve my community in this way. And so is my team. My team are so thankful to be a part of HSA and to serve the Cayman Islands community. And so we thank you for letting us come on and talk a little bit about what we offer. And if anybody has any questions, any concerns, they can email me or reach out to our team. We'll be happy to talk to them.
Thank you so much for stopping by today and giving us a little snapshot view of some of the things that you do over there. And just a reminder, folks, if you're just tuning in, and we've been talking extensively about the wonderfulness of the month. This month is very special. It's Better Hearing and Speech Month, all of the month of May. And we've been speaking with team leader, Ms. Faith, for speech and occupational therapy over there at the HSA. Thank you so much, Ms. Faith. Continue with the good work and keep on the path. I know sometimes it get weary, and I know sometimes get tired, but you have a whole community that is grateful and thankful for the work that you do.
Oh, thank you so much for having us, and thank you so much for your kind words.
All right, folks, wrapping it up. It's HSA Today. You could check us out tomorrow. We will be doing the broadcast. But you know what? Every Friday and every Saturday, we get together at 12, and we give you another snapshot of HSA Today. Keep it right here. This is Bobo 89.1 FM.